Hello. Good afternoon, everyone. I would like
Hello.
to introduce our guest speaker today, Dr. Ijeaku. She is a clinical faculty and associate professor of psychiatry and neurosciences at the University of California, Riverside School of Medicine, as well as attending psychiatrist at Riverside University Health System. Dr. Ijeaku has an MBBS from the University of Port Harcourt, Nigeria, and an MPH from Loma Linda University, and with the emphasis on medical epidemiology. She completed her general psychiatry residency program at Loma Linda University and her child and adolescent psychiatry fellowship at the University of Southern California. She is certified by the American Board of Psychiatry and Neurology in both general psychiatry and child and adolescent psychiatry, and is a distinguished fellow of the American Psychiatric Association. She is licensed as a consultant psychiatrist with the Medical and Dental Council of Nigeria. Let's welcome Dr. Ijeaku.
Thank you. Thank you, Shaleta.
So the first question I have for you today, what does Black health equity mean to you?
So when we think about equity, we think about how we can give everybody the same access, how we can give everybody the same opportunity. I always want to think about it in a way that I want to always differentiate it from equality, because equality is saying, okay, let's give everybody the same. But equity says, let's recognize that certain people have a disadvantage and we want to give them a little more to kind of bring, make the playing field a little more equal. So when I think of equity, and then when I think about it in terms of Black health, I'm thinking about all the ways, and there's so many ways and many levels of what we can do to make sure that we can give Blacks the same opportunity to maintain a healthy, have a better health status, whether we're thinking about their physical health, we're thinking about their mental health, we're thinking about, lifestyle, whether we're looking at all the indices that we use, whether it's maternal health, maternal mortality rate. So we're looking at lifespan, whether we're looking at other indices as well, just to see how we're doing in terms of our health status. So all the ways that we can try to make things better for Black people, knowing that Blacks are part of marginalized communities, knowing that Blacks have so many issues, social issues that keep them away from attaining what they ought to be attaining. So that's in some ways what it means to me.
No, that was a great answer. And why do you think it's so important that we talk about this issue, especially in the Black community?
I think it's really important that we talk about it because we know that the Black community has, from a historical context, has had some issues with the healthcare system, right? Whether we're looking at Tuskegee and all some of the issues that happened where people were, so when at a point in history, we did not have the ethical consideration of treating Black people appropriately. So sometimes it kind of makes people shy away from the healthcare system. There's a distrust, there's a mistrust of the healthcare system. So I think that continues to play into what's going on in the Black community. When we think about some of the health disparities that are evident, I was just looking at the fact sheet that was shared, that whether we're thinking about COVID, death mortality rates was highest amongst Blacks. Whether we're looking at longevity, lifespan, I was reading that the lifespan of Blacks in California is 5 years shorter than the average for the state. So even that, so we have very specific statistics that point out that we're not doing as well as others when you kind of compare these numbers. So it's so important that we continue to educate our communities, that we continue to educate the Black community and empower the Black community to sort of take charge of their health. So I think it's so important that we do it like all the time and through various means, so that people can, like, every corner needs to hear that this is so important. Because if we don't take charge, then nothing happens.
I agree with you 100% on that. It is very important that we take control over our own health, right? Because if we don't do it, guess what? No one else is going to do it. So my next question is, like, what advice would you give the Black community? So we all know that mental health is very taboo in our community, right? What advice could you give the community to let them know, like, hey, it's okay to talk about these different issues?
So when we think about mental health, I like that you used the word taboo. I was in a different space over the weekend where people were trying to talk about the origin of stigmata, right, as being something that you're kind of having this moral, spiritual background, and wanting us to sort of move away from the use of that word. So that was really interesting that you chose to use a different word, taboo. So I like the use of taboo. So I think that across all communities, I think, like, mental health is a taboo, no matter who you talk to. But I think specifically in the Black community, that it is even a bigger taboo, that people want to talk about it. People say, like, you know, how do you say that? Like, you know, buckle up, suck it up. You know, you're strong, you're this, you know, all of that. But I think what it's doing is that it's continuing to erode who we are. Like, we are losing the essence of who we are. We are trying so hard to, you know, put up this facade that everything is fine, that we're strong, that we can deal with stuff. You know, but meanwhile, you know, we have all these struggles. It is human to have struggles, right? It is okay to share this, you know, to share your experiences, to think, you know, think about all the things. And then when you kind of even think about beyond just the true psychopathology that anyone could, you know, could be faced with, the Black community continues to deal with additional stressors of racism. You know, whether we're thinking about structural racism, whether we're thinking of just kind of even the microaggressions on the day-to-day life, whether we're thinking about just other types of racism. So I just feel like it's like, I want the Black community to know that it is okay. We already know we have so much that we're dealing with. There's so many constructs, social constructs, that have placed us in these spaces that are all marginalized. And you know, when you think about the concept of intersectionality, right? So we have all these social constructs that continue to marginalize us. And when you think about an individual and you're trying to think about all the constructs that they belong to, and how all these marginalized, you know, spaces that they belong to continue to add up in very, you know, in very strategic ways, then why wouldn't we, you know, why wouldn't we just own it? Why wouldn't we show up and talk about these things that are, like, threatening to put us down, threatening to not let us breathe and be who we ought to be? So I really think that, you know, we don't serve anyone. Not one person is served when we want to suck it up or pretend that it's not there or act like. I know there has been a lot of mistrust of the healthcare system, but I really urge people to, you know, to seek help. I also encourage people sometimes. I say, you know, the first person you meet doesn't have to be the person that's going to be your care, you know, your provider. Right? Like just like when you want to buy a car, so, you know, you're not necessarily buying the first car you test drive. So, you know, keep looking until you find that person who really gets it, who really understands you, who treats you as the person that you are, with all the issues that, you know, that you're struggling with. But yeah, don't give up based on what has happened in the past, or based on one person who's just not doing the right thing for you. Just keep pushing.
I love that. And you made a great point, you know. Hey, if you go to your appointment and you're not really gelling with your physician, it is okay to request a second opinion.
Absolutely.
And then, yes. And a lot of folks don't know as well, like, if you're more comfortable seeing a provider who looks like you, you can also make that request as well. Okay.
Yeah. So
I'm sorry, go ahead.
I want to share something about that, like a point, just to kind of So it's been shown, research has shown over and over again that people will do better. And I don't think it's necessarily just mental health. People will do better when they have a provider who is culturally and linguistically concordant with them, right? So we know that that's already there, like research supports that. And what is one of those areas of disparities that Black people also struggle with, right? Because while we have like 13% Black people in the country, we only have about 5% Black physicians, right? So there's even in the provider, so that becomes problematic. But I feel like there are individuals and there are providers who have the cultural humility to understand that they may not always get what the person is saying. So when if somebody comes to you from a place of humility, say, hey, I know, I'm not pretending that I know what it is to be in your shoes. Even that, I think for me, that's a good start, right? So we cannot always just, like I said, we have 5% physicians, Black physicians in the country, that 13% Black people. So I mean, we don't have enough to go around. That's a fact. Hopefully we have some sort of pipeline through like programs like the Prime program that can get people who are, well equipped to deal with like issues that face the Black community. But beyond that, I know there are providers now who are just becoming a little more culturally humble, who would at least say, hey, I don't know what it feels like to be in your shoes, but I'm willing to learn. And I think we can work with that. So.
Yes, we can definitely work with that. We can definitely work with that. And if anyone has any questions, please do not hesitate to leave them in a chat. Dr. Ijeaku, we have our first question. So what are ways community members can show support or raise awareness?
Oh, that's awesome. So I feel like I believe that it takes everyone has to do their own part, right? So we know that when we think about the health, just even physical health, mental health of the Black community, it is way beyond what happens in my office or in the office of other providers. Health starts with like what food are you eating? How safe is your neighborhood? What type of housing situation? All of those types of things. So if we have community members, who can talk to their representatives about what's lacking in their communities, so we can enact policies that make sense. We have policies that can affect people in a positive way. It's good to get involved, so whether we're thinking about policies, whether we're thinking about even in the electoral process, who you're electing, like what do they believe in? What are their values? Are they more community oriented, or are they more just sort of, just to, talk the talk, but they can't walk the walk? Like you have to think about those types of things, because when you think about health, there is a really teeny percentage that happens in clinics. A lot of health is happening outside of clinics. A lot of health is how safe schools are, who's teaching your kid, where do you live? All of those social determinants, those are the big ones. So I hope communities are thinking about that, supporting family members too. So if you don't recognize a family member who is struggling, it's good that you're supporting them. It's good that you help them feel better about it. And I think another thing is continue to have. I know some. I don't know if I know NAMI, because I sit on the board of NAMI. NAMI has partnered with like faith communities to ensure that people are getting educated. So things like that, just sort of opening up that channel, helping people understand what mental health is, so that it's not the taboo that it used to be, so that it's easier to kind of get to it. And then showing people like access, having resources, like disseminating resources, even through the healthy communities, just putting resources for communities, like so people can quickly access these things. So those are some of the ways I feel like communities can help.
What a great response. And then once again, I just want to say, if you have any questions for Dr. Ijeaku, please leave them in a chat. So my next question to you is advocacy. Advocacy is really big. A lot of folks, unfortunately, don't know how to advocate for themselves. Can you explain the importance on how to advocate for yourselves, and then also family members as well when seeing a provider?
Okay, thank you for that question. I believe that when or who's struggling or their family members are trying to get help, it takes a lot to make that move to say, hey, I need help. Like that is a lot to say I need help. And I think all of us, we struggle, like everybody struggles with that, like wanting to, owning it, that you need help. So I believe that when you then have the opportunity to, that somebody's supposedly listening to you, it's important that you state clearly and, specific, like what your struggles are. But if you feel like that person maybe not truly understanding of what's going on, I think it's important to also speak up, like we're saying earlier, and it's important to make sure that you are heard, really heard, because I think that's the beginning of it, that's the basis of it. So we could advocate for ourselves in terms of like how we are getting the care that we need, but we can also advocate for ourselves in terms of like what are the policies that are being enacted that will affect our community. Right? Whether we're thinking about, okay, whether it's healthcare, insurance issues, whether it's the social determinants of health, any of those, like there's so many layers to think of it. Or whether it's issues or policies that will, tear down, racist policies that are already in place. This like just how do we like make sure that we have, whether it's at the level of policies, whether it's the level of provider, whether it's the level of being heard as the individual, just kind of the one-on-one, just being able to let people know what you're struggling with. I think it's so important that we embrace this culture, the culture of speaking up for yourself, advocating for yourself, knowing that you're worth it. Like if you're making the move to even get help, like make sure that people are like hearing you. And I think we ought to do a better job of just kind of empowering ourselves, So like in medical school, nobody talked about advocacy, but it's just something that, I sit in my office, I see the patient, I say what I need to say. But until I got involved in organized psychiatry and organized medicine, I didn't really understand like just how much more power people outside of my office have over my patient, right? So it's just this idea that we need to really wake up and really pay attention that people will say, if you don't grab a seat and be on that table, you're going to do what people at the table decided would happen, right? So it's kind of, if you think about it from that level, from the level of like policies and politics and who you elected. So all of that is important to help as well. Who is this person you elected? What do they think about your health? What do they think about you as a person? How do they support you in terms of your community? And how do you ensure that you can put people in place who can hear what you have to say? Because if people can't hear you, then then they're not getting the right feedback and they cannot respond. So all of that is important. So kind of looking at it from societal levels, and then again, like I had said earlier on, looking at it from the personal levels, also being able to really speak and know that you've been heard. And if you have not been heard, hopefully there's an avenue for you to get like a second opinion or look for a different provider.
Great, that's all good advice. And I love how you mention you have a voice. Like we all have a voice, and it's so good to get involved. Send that email to your congressman. Make that phone call to your congressman, because when these bills are coming out in regards to your health, you can make a difference by, like I said, emailing your congressman and also making those phone calls as well to make a difference and make a change. And then once again, I'm going to tell you all, if you have any questions, go ahead and drop them in the chat. So my next question to you, Dr. Ijeaku, is what other advice that you can give folks on Health Equity Advocacy Week? And this is the first year that we are doing this. And you are kicking off the week.
Oh, okay.
Yes, you are. So what other advice, before we let you go, can you give in regards to Black Health Equity Advocacy Week?
So I am hopeful that we are hearing enough about what is important. meaning that there's so much that is going on that is outside of what is happening in that office, that it's important that we, first of all, recognize that, like we're saying earlier, that every individual has a voice. Every individual's voice can say something, can turn that needle, even if it's just a little bit to one side, but you can definitely move that needle. So I think the way to think about it is, we all, like you said, we all have a voice, and so that's one. As an individual, you have a voice, you can be heard. It is also even more powerful when we think about what can happen when we collaborate. So if we recognize that this is important to us, and this is important to to our community, to our health, to our families, it's important that we're also looking at other people that, like-minded people who are also thinking the same thing, so that we can collaborate and form a community of people who want the same thing, and that's how we kind of build up movement. Because when we are putting our voices, like, every individual voice is powerful, but when we put all the voices collectively, we're even much more powerful. We can definitely move that needle way, beyond wherever it is standing right now. So I think what I have learned in my journey as a provider, who works in underserved communities, is that every individual that I have worked with has a voice. A lot of times people don't recognize that they have voices. People have, their voices have been suppressed. They don't think they have the voice, but they do have the voice. I think it's at the time with the information age and the social media and all that, it really, I'm hoping that people really understand how much that is. Like, you can put something out there that could change conversations. So that's one, you do have a voice. The second one is to collaborate, to think about other people that share the same values, that share the same ideas, people that want the same thing, and reach out to them and find ways to have the collective, so that with the collective, you have a stronger voice, you have a much more powerful voice, and then you can actually get the change you're looking for. Because at the end of the day, we are wanting the change. Because if we are at point 0, but point 0 is not working for us, and we're trying to get towards point 1, we have to do something to move from 0 to 1. So the question is, what are we going to do? Do we just pretend that we're not in 0, or do we pretend and just sit on 1 and hope that at some point somebody else will move on? We have to kind of own it. We have to, take it up by ourselves, and identify what our issues are, speak up for ourselves, collaborate with people who are like-minded, who share values with us, and then with that stronger voice, we can move things forward and bring about change.
Yes, Dr. Ijeaku, your voice is important. Utilize your voice, folks. Don't be afraid. Don't be intimidated. If you want change, you have to utilize your voice. So I have a last question here. As a medical student, what are some ways I can begin getting involved in advocacy? You are right. It isn't something we are taught. Yes. So it's a question and a statement.
It's a question and a statement for sure. Yes, so we are not taught for sure, but I would encourage you to join organized medicine. For me, joining organized medicine made all the difference, because organized medicine is what opens your eyes to what happens, or the power that other people have over that patient that you have in your office for, like, whatever, 15, 20, 30 minutes, an hour, maybe if you're lucky. But there's so much more going on with your patient outside your office. So if you think about all the other things going on with your patient outside that office, then that tells you how much power there is outside of yourself. So in as much as we have with the physicians, we do have the power, yes, but we cannot act alone. It will never be enough. So staying active in organized medicine for me was one way that I really got myself involved in what is important outside of my office. For those within mental health, joining grassroots in, organizations like NAMI, National Alliance of Mental Illness. I sit on one of their boards. Being part of, like, whatever specialty you decide to go into, being part of that aspect of organized medicine, very, very important, and is a way to grow, is a way to also get involved with and collaborate with like-minded people. like yourself. So you could get mentored, you could network, you could collaborate. But again, when we do it in a collective, we move the story to a different point. So.
Yes, all great resources and advice. I hope you all caught that. So this brings us to a close today. I want to thank Dr. Ijeaku for attending the Center for Healthy Communities live on Black Health Equity Advocacy Week. Thank you.
Thank you for having me. This was fun. Take care.
Bye, everyone.